Yo guys, welcome to our channel today, and kindly if you have not subscribed, I want to encourage you to subscribe. Our channel is Nazvin. This is where we get to discuss matters medical in a simple language which we can always understand and share whatever is very vital in our health. My name is Vincent, channel is Nazvin. Like the video to get YouTube to recommend us. Give a nice comment down below, share widely, because most of us who are watching the video kindly you have not subscribed, and I want to give you 5 seconds so that you can subscribe. Kindly subscribe guys. You have your 10 seconds to click that subscribe button. Today we're going to talk about testicles, and I have a question. Do small testicle affect your health? Do small testicle affect your health? That's what we're going to talk about. While smaller than average testicle may not necessarily indicate a healthy problem, there are potential implications to consider, and I'm going to state some of those factors which you should keep in mind. Number one is about fertility. Testicle size can be related to sperm production, though smaller testicles may produce fewer sperm, which could potentially affect the fertility. Number two consideration is about hormonal imbalance. Testicles are responsible for producing testosterone, and the primary male sex hormone, that's what we call testosterone. So changes in testicle size could affect this hormone, and also influence the amount of testosterone being produced, and this may affect the overall health and also the sexual health of or sexual function of an individual. Number three is about testicular disorders. In some cases, smaller testicles may be a symptom of underlying testicular disorders, so such as what we call testicular atrophy or varicocele. So that is another condition, and this condition may require medical attention and treatment. Number four is about the self-esteem issue which can come about. So with the self-esteem, we talk about the impact of the small testicles to the body image, and also particularly in the social intimate situation. So it's important to address any psychological distress, and also which can be associated with perceived inadequacies. Number five, also consideration which can come about, is about testicular cancer. While testicular size alone is not a definitive indicator of testicular cancer, changes in size, shape, and also texture of the testicle should be prompting you to be evaluated by a healthcare provider, so that you can get early detection for the testicular cancer and also treatment of the testicular cancer, which can improve the outcomes at the end of the day, because the early approach and also the treatment can be very helpful for you if you get that kind of treatment. So while having smaller testicles may not necessarily pose a health hazard or a health risk on its own, it is essential to monitor of any associated symptoms or changes in the testicle size and function. So regular self-examination and routine checkup by healthcare provider can help provide or detect any potential problem, issues, and also ensure optimal testicular health. If you have any concerns about the testicular size or function, consult with the healthcare provider for proper evaluation. How can you manage the small testicular problem? So on medical evaluation is one of the key things which needs to be done as a form of management. So the management of smaller than average testicles depends on underlying cause and also associated symptoms. So the general management strategies about medical evaluation is number one, where the testicular size or notice any changes, seek evaluation of a healthcare professional, and which can perform, where the healthcare provider gets to perform the physical examination on those testicles, and also review your medical history and other tests which can such as hormonal levels, image studies to assess for any underlying condition. Number 2 is about treatment of underlying condition. From the medical evaluation, we go to treatment of underlying conditions. If small testicles are due to underlying medical conditions such as testicular atrophy or varicocele or hormonal imbalance, treatment can be very necessary. This involves medications, hormonal replacements, and also surgical interventions as appropriate, so that depending on the specific diagnosis which has been made. Also, fertility evaluation is also another concern. If there's a fertility concern from the particular patient or from you, consider undergoing fertility testing, and also to assess sperm count, motility, and also morphology for the sperms. Depending on the results, treatments such as vitro fertilization or IVF, and also intrauterine insemination or IUI may be options to consider. Number 5 is about psychological support, where if concerns about the testicular size impact your mental well-being or self-esteem, so here we consider seeking support from a healthy mental professional who can do counseling and also therapy, which can provide strategies of coping with the body image issues and also improve the overall psychological health of an individual. Number 6 is about testicular self-examination exams, where we performing the regular testicular self-exams to monitor any changes, and also follow-up and monitoring especially for underlying conditions where depending on the condition, the treatment is introduced. So with the regular checkups and also with the self-examinations of the shape, by taking on the shape, texture, and testicle of the testicles, may prompt one to report any abnormalities to your healthcare provider for further evaluation. Number 7 is about follow-up care, where follow-up of healthcare provider recommendations for follow-up and monitoring is very key, especially if you have an underlying conditions or undergoing another treatment. So regular checkups can help ensure that any changes in testicular health are promptly addressed as appropriate. So guys, the management of smaller testicles, identifying and addressing any underlying condition, optimizing overall health well-being, and seeking appropriate medical care as needed by working closely with the healthcare providers and adopting healthcare lifestyles. So, and health lifestyles and habits for an individual is very important for the testicular health to address any associated conditions effectively. So sometimes we have complications associated with the small testicles. Number 1 is about, and it's a grave concern, where, like we said, while having smaller than average testicles may not inherently cause complications, underlying conditions associated with testicular size abnormalities can lead to potential complications, and I'm going to state some of the complications which you need to be aware of. Number 1, great concern about these smaller than average testicles is about infertility, where smaller testicles may produce fewer sperms, potentially impacting the fertility. Conditions such as the testicular atrophy, varicocele, or hormonal imbalances can contribute to reduced sperm production, leading to infertilities and also difficulty in conceiving. So, and also number 2 is about hormonal imbalances. Changes in the testicular sizes indicate hormonal imbalances such as the low testosterone levels. Hormonal imbalance can affect various aspects of one's health, including the libido, including the sexual function, muscle mass, and also bone density. So, and also number 3 is about psychological distress as a complication, where concerns about testicular size or fertility can lead to psychological distress, including anxiety, depression, decreased self-esteem. So these emotional challenges can impact relationship and also sexual function and overall quality of life at that particular point. Number 4 is about testicular cancer as a complication. While small testicles alone is not a definitive sign or indicator for testicular cancer, this size, the changes in testicular size, shape, texture should be evaluated by a healthcare professional. So testicular cancer can present with as a lump or a swelling, where testicle require prompt diagnosis and also treatment at that particular point. Number 5 is about sexual function as a complication, where hormonal imbalances or psychological distress related to testicular size and also may contribute to the sexual function, including erectile dysfunction and decreased libido, performance anxiety. These issues can affect sexual satisfaction and also intimate relationship at the end of the day. Number 6 is about reduced bone density, and this comes about with testosterone plays a crucial role in maintaining body density. So the low testosterone levels associated with the small testicles can increase the risk of what we call osteoporosis, where now we can develop bone fractures over time. Number 7 is about relationship strain as a complication, where concerns about fertility or sexual function can really affect one is the intimate relationship, leading to communication difficulties, decreased sexual satisfaction, and also relationship conflicts at the end of the day. While small testicles themselves may not relate to complications, it is essential to address any underlying conditions or concerns which may contribute to testicular size abnormalities. Seeking medical evaluation and treatment is key, where we get to address psychological distress at the same time, maintaining overall health well-being, and also crucial steps in minimizing the risk of complications associated with small testicles. So regular checkups and open communication with your healthcare provider is very important and very key, where you can help identify and address any potential signs early. So how can we prevent these complications associated with the small than average testicles? This involves addressing particular issues, where and some of those preventive measures, I'm going to mention them, is about, number 1 is about regular medical checkups. Schedule your medical checkups with your healthcare provider to monitor testicular health and also address any concerns or abnormalities promptly. Number 2 is about testicular self-examination. So perform your testicular exams to monitor for any changes, shape or texture of your testicles. So promptly report any abnormalities to your healthcare provider for further evaluation. Number 3 is about maintaining a healthy lifestyle, where adopt a balanced diet, like taking a lot of fruits, vegetables, whole grain, lean proteins, and healthy fats to support overall health well-being. On the same, maintaining a healthy lifestyle, engage in regular physical activities such as the aerobic exercise and strength training to promote the cardiovascular health and also maintaining healthy weight. On the same note of maintaining a healthy lifestyle, we are talking about avoiding smoking, excessive alcohol consumption avoided, and also taking off the illicit drug use, which negatively impact testicular health and also hormonal levels. Number 4 on how we can prevent these the complications is about protect the testicles. Wear protective gear during sports or activities that pose a risk for testicular injury, such as athletic caps or groin guards. So very important. Also very important, practice safe sex to reduce risk of sexually transmitted infections that can affect testicular health. Number 5 is about manage underlying conditions. Seek treatment for underlying medical conditions so that these conditions which can contribute to testicular size abnormalities such as testicular atrophy, varicocele, and also hormonal imbalances or infections which can affect how your testicles function. Also, follow a healthcare provider recommendation for any treatment and management of various conditions to minimize the impact of the testicular health. Number 6 is about testicular psychological support for that particular point. Address any psychological distress concern related to testicular size, because through counseling, therapy, and group support groups where mental health support can alleviate anxiety, depression, and self-esteem associated with testicular abnormalities. Number 7 is about fertility evaluation, where if you have a fertility concern, undergo fertility testing to assess sperm count, motility, and morphology. So early detection of the fertility issues can help guide appropriate treatment options such as reproductive health technologies. So on the prevention of these complications, it's very important that you get a multi-phased approach that includes regular medical checkups, testicular examinations, maintaining health lifestyle, protecting the testicles from injury, and also managing underlying conditions, seeking psychological support when needed, and addressing fertility concerns proactively. So by prioritizing testicular health and well-being, individuals can reduce the risk of complications and promote overall reproductive health. So guys, in summary, smaller than average testicles may not necessarily pose immediate health risk, but they can be indicative of underlying conditions that impact the fertility. So hormonal balance and also the well-being of an individual. So complications such as infertility, hormonal imbalance, psychological distress, testicular cancer, and also sexual dysfunction, reduced bone density, and also strain in the relationship can become about with as a form of complication. And also we can have preventive measures for this, like regular medical checkups, testicular self-examination, maintaining health lifestyle, protecting the testicles from injury, managing underlying conditions, seeking psychological support, and addressing fertility concerns proactively can work as a